This October is Breast Cancer Awareness Month, and former Bachelorette star Katie Thurston is opening up about her stage 4 diagnosis at just 34 years old. The reality TV alum took to Instagram to share how we can take action this October.
This Breast Cancer Awareness Month, we are more than just wearing pink, and we are turning awareness into action. I created a GoFundMe to benefit the American Cancer Society with their breast cancer action campaign they have going on. I'm turning donations into dog walks. Every dollar donated is a 1-minute walk for Charlie. Together with GoFundMe and American Cancer Society, we are taking action.
Joining us now is Fox News medical contributor, Dr. Nicole Saphier. Nicole, it's so great to have you back on, and such an important topic when you know a lot about. So tell us what kind of awareness we should have. What should we be doing as women to prevent breast cancer?
Well, Rachel, first of all, I love this topic. Yes, it is October Breast Cancer Awareness Month. You see a lot of pink out there. And while a lot of people talk about early detection, getting your mammogram, making sure you're checking for all the lumps and bumps you may have in your breast, this is a very important message, because what she is talking about is she is living with stage 4 or metastatic breast cancer. And in fact, there are about 200,000 women in the United States who also have advanced breast cancer. And so while the emphasis is always early detection, the reality is not everyone is diagnosed with an early stage breast cancer, and there are lots of women and men living with advanced breast cancer. And so ultimately the goal is to, yes, prevent breast cancer, try and detect it earlier when it's easier to treat with less invasive treatments. But for the people who have advanced cancers, thankfully we do have some treatment options that are allowing them to live for months to years to decades longer, even after this advanced diagnosis.
That's really important news, and something that makes us all very hopeful for those who get that diagnosis. Can you talk to us really quickly about how breastfeeding can help prevent breast cancer?
Well, we love talking about this.
Well,
there are really important things you can do to lower your risk of breast cancer. Of course, being a woman, getting older, you can't do anything about that. But yes, breastfeeding, having babies, this all decreases your risk of breast cancer. Also making sure that you have less excess fat by maintaining a healthy weight, getting outside, walking. That's why I love what she's doing. She's actually walking her dog. Do you know that by being outside, that physical activity, being with animals, all of these things can decrease your risk of inflammation and decrease your cancer risk? And right now, she has to do everything she can to try and keep that cancer at bay. Yes, medications do a lot, but it also takes a lot of things that you as an individual can do as well. Getting active, maintaining healthy weight, and doing all of these other things are very important to decrease your risk of not only developing cancer, but having it coming back when you have advanced disease.
Great stuff, Nicole. All right, let's talk about this, because Amazon is launching telehealth services for kids. And I have to tell you, I love this idea. It's really hard sometimes. Kids are sick, to get them to the doctor's office. You also go, I don't know if I want to go to the doctor's office. They might pick up something else at the doctor's office. Why can't I just have them home? So tell me how this all works, because I'm starting to think I love this.
Okay, so I have mixed feelings about this model that Amazon is putting forth, and I'll tell you why that is. So first of all, this is their, I think it's called Amazon Medical One model, and essentially what they're doing is you can have either messaging access or you pay a little bit more for video access to a family practitioner. Now, they're very careful with their wording. You're definitely not seeing a pediatrician or a physician who's specialized in treating kids, and it doesn't sound like you're even seeing a family medicine doctor. You're probably seeing some advanced provider like a nurse practitioner or a physician's assistant. Now, the reality is they absolutely have their role in medicine. They help with access and lowering costs. It sounds like right now they are seeing very specific things like children with pink eye, children with rashes, and refilling asthma medications and EpiPens. This is not what you should be taking your child to for sickness. I also love the idea of some sort of telehealth, but I like it more for strep throat, flu, COVID, all those other things where you need to be swabbed, and this certainly isn't that. So I think they have a little bit more evolving to do, but it's a good start, especially when it comes to getting access and lowering the cost of care.
Yeah, and I think it's moving in the right direction. Thank you so much, Dr. Saphier, as always.
Thanks for having me.
You got it. More Fox and Friends still ahead.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.